get some more insight, medical insight from Dr. Peter Chin Hong. He's a professor of medicine and an infectious disease specialist at University of California, San Francisco. Doctor, what is the risk to President Trump's health considering his age, 74, and his weight?
Well, Asya, thanks for having me on. I'm very worried about the president. If I contrast him with Melania Trump, for example, they form two divergent cases of the types of patients we see in COVID. Of course, nothing can happen to the president, but he's already exhibiting symptoms. He can either continue to have symptoms and recover, or he can continue to have symptoms and proverbially fall off the cliff in about 1 to 2 weeks, which we see happen in individuals, particularly with his age and comorbidities, particularly his obesity. To give you some perspective, if compared to a 30-year-old, if you're about 75, you have an 8 times more likely chance of going to the hospital and a several-fold higher chance above that of dying. Added to obesity, which is about 3 times the higher risk of dying itself. When you add all these risk factors together, you can see we're not talking about a small risk.
And another part of the story is there's so much that we don't know about this virus. Clearly, it affects different people differently. We saw British Prime Minister Boris Johnson getting very, very sick, but Brazil's president, Jair Bolsonaro, did not get sick. So talk about that part of the story.
Yeah, so we know what are predictors of mortality or death once you get into the hospital and you are sick. But we have very little information about who progresses and who doesn't. I would say that age is probably a good predictor of progression, but beyond that, we don't really know how obesity, et cetera, relate to progression. However, we know once you've progressed, those factors increase your chances several-fold of dying.
And we also know that the president has repeatedly, in springtime, touting hydroxychloroquine. He told reporters in May he started to take this anti-malarial drug. Well, clearly, that didn't work, did it?
No, I have zero or negative confidence in hydroxychloroquine. We have 7 randomized trials now showing that it has absolutely no benefit. In fact, it can cause harm in terms of cardiac arrhythmias in the wrong person.
If you were the president's doctor, Dr. Chin Hong, what would you be advising him right now?
So I think what I would tell him is what I would typically tell my patients in his situation who have symptoms but are not terribly sick yet, is to sit tight, monitor your shortness of breath, your taste and smell, which is sometimes a harbinger of badness to come. But sometimes we don't feel a sensation of shortness of breath, even though oxygen levels in the blood are low. So some individuals use pulse oximetry at home, and I feel confident that his physician will probably use it. The other aspect I'm wondering about is whether or not the president will advocate for some atypical uses of drugs that have already undergone expanded emergency use authorization, like convalescent plasma. Theoretically, that will have a benefit in early disease, although no one is using that in standard practice at that moment outside of a clinical trial.
What about mask wearing, doctor? What would you tell him about that?
I would say that the vast majority of information supports mask wearing, not only to protect yourself, but to protect your community and people around you. I'm worried that the White House is going to become, and the horse is probably already out of the barn, a super spreading event. It's going to be another super spreading event that we'll talk about in years to come.